All right, today marks World Cancer Day, that is February the 4th, and I am joined in studio by the CEO of the National Cancer Institute of Kenya, and that is Dr. Melly, who is also a consultant clinical oncologist. Good to have you in studio this evening. So the theme this year for the 2022 to 2024 is closing the gap, generally speaking.
Correct.
The specific theme this year is Together We Challenge Those in Power. And one of the challenges is to allocate more resources towards early detection, treatment and care, as well as a diagnosis. So where are we as a country where that is concerned?
Well, thank you, Oli, for inviting us to studio this evening. Really, the cancer burden in our country has increased significantly, just like it has increased globally. And just 3 days ago, IAC released the current, statistics of cancer across the world. And if you look at Kenyan data, we are seeing, the burden is rising. We are now, talking about 44,000 new cases diagnosed every year in our country, and 29,000 of these are dying every year. These are alarming statistics that should keep and leave all of us worried. Remember, cancer is one disease that does not discriminate whether you are young, you are old, you are rich, you are poor, you are educated, you are
But it seems to discriminate more against women than men, looking at that data.
Unfortunately, if you look at that data, 28,000, of those who are diagnosed were women, while 16,000 were men. And there's a caveat to that. It is because, if you look at the top 5 cancers, most of them overall are women cancers. We are looking at breast cancer and cervical cancer. This is one gender that has both organs that men do not have, and it's the most prevalent, though we have some men who get breast cancer as well, though. But the number one, cancer amongst women is breast cancer, and the number one, cancer that causes mortality is cancer of the cervix. And if you look at those, they are quite top. So that is the reason why it seems to discriminate against women. It is just, a matter of figures. WHO, has called on us to close the care gap, and we're really working on that. And the National Cancer Institute of Kenya, which is the agency mandated by Ministry of Health to reduce the burden of cancer in our country, is very strategic at this point in time. And I mentioned earlier on that we have a plan that we are implementing to the latter, called National Cancer Control Strategy 2023-2027. By the time this is implemented, with the support that the theme of this year is calling on nations to invest more resources. And we are really asking, the government through National Assembly to allocate more resources during budget making process to cancer, because it is one disease that is really terrorizing all of us. It terrorizes our social life, our economic life, our spiritual life, our physical lives, and people do not work. It's an economic, issue as much as it's a physical issue. So we are here to make sure that we put the right strategies, and we thank God because we have a government now that has put health among the top priorities, in this current government. And we do believe that with the late strategies, and as we continue providing guidance, at the National Cancer Institute of Kenya, we provide that advisory. That's our function number 1 to our Cabinet Secretary of Health on priority interventions in cancer prevention and control. Earlier on, we talked about cancer registries data and cancer research, because we really want to understand ourselves so that we are able to advise. Even as we do resource mobilization for cancer work, we have actually understood what are we, investing these resources on, and what are our expected outputs, outcomes, and ultimately impact, which is reducing the burden of cancer.
All right. Before I let you go, this administration you mentioned earlier has been pushing UHC, and we had the NHIF. Now we have SHIF, the Social Health Insurance Fund. What does that mean for access to cancer treatment in Kenya, as well as diagnosis? What are the early indicators with that? Will it drive us closer, for example, where cervical cancer is concerned, 90, 70, 90?
Yeah, we have this call to action by WHO to eliminate cervical cancer by 2030, and we want to vaccinate 90% of our girls by 15 years We may consider men at some point because it's also an issue. And we would want to screen, 70% of all our women at 35 and 45 years of age. And we also want to treat 90% of those who are diagnosed with pre-malignant or malignant, which is cancer conditions, in our country. And our government, through the current healthcare reforms, which includes the new healthcare financing outfit, which is the Social Health Authority, the big wins or the big winners of these reforms actually is cancer care. Because if you look at, as much as we would want UHC to be implemented and to have an impact across all the diseases, we are looking at cancer specifically because it is probably the most expensive, disease to treat. And looking at the 3 funds that the Social Health Insurance Act provides for to be managed under Social Health Authority, the Primary Health Care Fund, it is going to cover on matters prevention and matters screening at level 1, level 2, level 3. And we have Social Health Insurance Fund, which is going to be administered mainly, which we are calling on everyone to accept the 2.75% deduction of their gross salary for those of us who are employed, so that we can provide equity in our country, instead of having those who are earning less pay more than those of us who are privileged to have a job. And this one is going to take care of the packages. If you're going to be diagnosed, diagnosis has been a challenge. Previously, NHIF did not fund diagnosis. And you cannot treat what you have not diagnosed properly. If people cannot afford diagnosis, then what are you treating? So it is a big win because now SHA is going to provide for comprehensive coverage for both laboratory diagnosis, imaging, and pathology, which is our pillar number 2 in this action plan. So working towards our 49 billion journey to implement this, SHIF comes in big. And also treatment for cancer with surgery, with radiation, with chemotherapy, even some of the most expensive drugs that are now novel molecules available that are more targeting cancer care in our country, so that we can get better outcomes like other high-income countries that have invested heavily. This is the way to go. Okay. And if they exhaust the Social Health Insurance Fund, we have the Critical Emergency and Chronic Illness Fund that is going to pay for the excesses, because cancer treatment is long treatment. It is 6 months to 1 year to 2 years, like in children. If you are treating leukemia, which is a curable disease, 80% of leukemias in children in high-income countries are cured. So it is a long treatment. We really want to thank our country for this transformation in healthcare, because fully executed, fully implemented, resources allocated to it, we surely will address this challenge.
All right, thank you very much for speaking to us, Dr. Melly. Interesting that today, tragic actually, that the Namibia president
unfortunately
passed away.
Passed on from cancer.
And he had suffered from prostate cancer. He was diagnosed with cancer and was receiving treatment, I believe, in the US.
In fact, Olive, just 5 seconds of silence for those who have departed from cancer.
All right.
Thank you very much.